Hi everyone, welcome back to a new video. Today I want to carry on from where I left off last time, and that was about Claire Week's her recovery process. I think last time we mentioned the facing aspect of anxiety. In this video I want to talk about the accepting part of anxiety. So without further ado, I'll get right into it. So accepting. After becoming prepared to face, the next step is acceptance. And as acceptance is the key to recovery, we should be sure of its meaning. Acceptance means letting the body loosen as much as possible and then going toward, not withdrawing from, the feared symptoms, the feared experiences. It means letting go, going with, bending with the willow before the wind, rolling with the punches. When one goes forward this way into panic, into any of the feared symptoms, the secretion of the hormones, principally adrenaline, producing the symptoms is reduced, even if only slightly. It is reduced. On the other hand, tense withdrawal encourages further secretion and so more sensitization and therefore more intense symptoms. While at first acceptance of physical symptoms, especially panic, may seem impossible, practicing thinking about acceptance is always possible, and this alone can release some tension, although perhaps only a microscopic amount to begin with. So that when it comes to do its worst, the worst is tempered. If you stand taut and say bravely with clenched teeth, "Come and do your worst, but get it over quickly," you are only putting up with. A patient will complain that he has accepted, but that the dreaded symptoms are still there. "I have accepted the churning in my stomach, but I still have it, so what do I do now?" How could he have accepted while he's still complaining about it? The most frightening symptom is panic because, in a sensitized person, it can strike so fiercely and so quickly. Merely thinking about it apprehensively can bring it on. The natural reaction is to recoil, to tense up, to try to stop it, to try to stop the flash coming. However, tension brings more sensitization and so more panic. Acceptance is a definite physiological process that eventually soothes. I say eventually because the soothing can rarely be felt immediately. Acceptance is the beginning. Established sensitization can rarely be soothed quickly because it takes time for the new mood of acceptance to be felt as peace. Although the symptoms of nervous illness, anxiety, are always the expression of mood, they are not always an expression of the present mood. When acceptance is first practiced, the body may still be registering the tense, frightened mood of the preceding weeks, months, years, and may continue to do this, but with progressively reduced intensity, even after the mood of acceptance is established. This is why anxiety can be so puzzling. An anxious person may begin to accept, but when the symptoms do not quickly disappear, he loses heart and becomes apprehensive once more, although trying to convince himself that he is still accepting. I repeat, it takes time for a body to establish acceptance and for this to bring peace, just as it takes time for fear to be established as continuous tension and anxiety. This is why letting time pass, the last of my 4 concepts, is so important in treatment. Understanding makes acceptance so much easier. It is unnecessarily difficult to accept erratic heartbeats if the victim believes that his heart is diseased. How much easier when he understands that the unevenness of those beats is no more than a temporary and unimportant upset in their nervous timing. Adequate explanation is indeed a boon to the patient preparing to accept. However, it is not always given. One woman said, "I can't describe how I feel. I just feel funny. The doctors just look at me and give no explanation." Feeling funny can be an accurate description of how an anxious person does sometimes feel, and describing his funny symptoms can be difficult, because symptoms of fatigue and anxiety, when working together, can be vague, undefined, and vague symptoms can be just as upsetting as more definite ones. If you feel like this, providing your doctor has examined you and said that your funny symptoms are nervous, accept them, and be comforted to know that funny feelings are common in anxiety and never important. Blind acceptance can cure as well as acceptance based on knowledge. But when knowledge guides acceptance, acceptance is easier. Some doctors, while knowing that funny symptoms are nervous, do not understand their physiology and so cannot explain them. So, while funny nervous feelings should be accepted without full explanation if none is available, explanation of more definite symptoms, weakness, trembling, headache, palpitations, difficulty in swallowing, and so on, should be sought. I explain these in detail in my first book, Self-Help for Your Nerves. Don't think I use the word acceptance lightly. I know what I am asking. It's not easy to accept the fire that consumes, not easy to work with the fire burning. It's not easy to accept and work with a body that feels as if it's vibrating, shaking, with stomach churning, limbs aching, heart pounding, sight blurred, head swimming. I'm making it sound terrible, aren't I? It can be terrible, and it is made worse if the mind, at the same time, feels as if it's drawn out into a frail thread that will snap with the slightest extra tension. I understand all this, but I still preach acceptance. Recently, a woman phoned to say that that morning had been especially rough for her. She had come through by saying to herself, "I'll be talking to Dr. Weeks in a couple of hours. I'll have some peace then." The thought of the peace to come sustained her, but living for such peaceful moments was not good enough. It meant that she would make little progress. There is lasting peace in waiting for someone else to bring it. There is no lasting peace in waiting for someone else to bring it. Such relief from suffering is only a respite. I explained to this woman that peace lay within herself and depended on her attitude when the symptoms were at their fiercest, and that was the moment for her to practice the acceptance that would help her find lasting peace. She thought for a while and then said, "You mean I have to find the eye of the hurricane?" She had the message at last. Sailors say that at the center of the hurricane there is a place of peace, which they call the eye. The storm swirls around, but cannot reach it. To find it, the ship must go through the storm. If that woman were to work as willingly as possible, accepting the symptoms, the hurricane, and not add second fear, she would find the eye of the storm herself. And although the symptoms may at first seem as fierce as ever, there would be some peace and reassurance in knowing that she was on the right course at last, without having to wait for the doctor's soothing words. Peace of mind built on earned confidence lies not in the absence of symptoms but in their mist, and it is only when one discovers this that the intensity of symptoms abates and there is peace. The process, of course, is gradual. The next day, the woman reported that while feeling ghastly, she had sat at her work. She was an artist and had painted for 2 hours. For the first time in months, she was able to lose herself in her work, while the hurricane raged within. For once, the hurricane did not seem so important to her. It takes courage to face the storm, and let happen what will. That woman had been shrinking from the way she felt for 20 years, and was still anxious. Surely it was time she tried another approach. Tried to go into the storm, accepting it willingly, well, as willingly as she could manage at first. Many are helped by understanding that the flash of panic is no more an electric discharge. That while it may feel devastating, it is only an electrical discharge along sensory nerves. So many people allow electrical flashes to spoil their lives by withdrawing from it in fear. As I have explained so often, fearful withdrawal produces the hormones that stoke the fire of panic. Facing and relaxing toward with acceptance help to dampen the flow and eventual stop of it. A sensitized, bewildered person, feeling his panic grow stronger as his sensitization increases, may imagine being flooded by an irresistible tidal wave of panic. He should understand that there is a limit to the severity of even his panic. If he analyzes his fiercest flash, the flash he thinks too fierce to bear, he will find that at its peak, he is shudderingly withdrawing from it. Whenever he fears panic, he can eventually quell it only by going forward into it, never by withdrawing from it. A person sustained by this knowledge will one day be surprised by feeling panic sweep over him, and yet feel aloof from it, as if looking down on it. He has lost his fear of panic. We talk about rising above a situation. There is no better example. When there is no longer fear of panic, it gradually subsides. Time becomes the healer. I stress again and again that cure lies in losing fear, and that this is earned only by learning how to go through it in the way, with acceptance. With such understanding, it is possible to be cured immediately. I have seen this, but of course, rarely. Repeated panics can be exhausting. This is when I advise moderate and temporary tranquilization and occasional rest on sedation to help the sufferer gain strength and refresh the spirit. Tranquilization must always be planned so that the sufferer still earns his inner supporting voice born from having faced and accepted. I talk so much about panic because I am using it as an example from my hierarchy of nervous symptoms, palpitations, churning stomach, trembling hands, and so on. When the sufferer learns to accept these without adding second fear, they also gradually subside. They must, because they too are the symptoms of fear. You may ask, but what if an anxious person is kept constantly stressed, perhaps frightened by some problem, perhaps an upsetting domestic situation that is difficult to change? How can accepting the nervous symptoms help him? It can't solve the problem. It can't. However, people who develop nervous symptoms because of the stress brought by a problem can also be further upset by the symptoms themselves. The iron band headache, extreme fatigue, quickly beating heart, sweating hands, and so on. Surely, understanding the nature of these symptoms helps lessen fear of them, and so gives greater opportunity to concentrate on trying to solve any problem. If you are reading this because you are anxious, I want you to practice acceptance now. Make yourself comfortable. Take a deep breath. Let it out slowly. Let your tummy muscles sag. Give way and try to feel a willingness to accept. Try to feel this in the pit of your stomach. Practice now. Did you have a fleeting feeling of acceptance? If you did, you felt the birth of recovery. Continued acceptance will gradually finish the job. It is necessary to understand the difference between true acceptance and putting up with. Putting up with, although calling for much bravery, means resistance. It means advancing and retreating at the same time. As I said earlier, it is an attitude of hurry. Come quickly and get it over. True acceptance means facing and relaxing, being prepared to go slowly with as little self-induced agitation as possible. It is submission. I have used acceptance again and again in writing and recordings. You may think I place too much importance on it. How could I when it is the key to recovery? I have said so often that peace lies on the other side of panic. Now I shout it. By going through panic to the other side, you earn the little voice that says, it doesn't matter anymore if panic comes. This is the only voice to listen to. It is your staff and will always come to help in setbacks. Even if you find yourself almost helpless on the floor. As it lifts you up, you will feel again that the dreaded bogey no longer matters. Bogey. As it lifts you up, you will feel again that the dreaded bogey no longer matters. As this realization strengthens, courage returns, and you once more find the confidence to practice utter acceptance, perhaps even more willingly. Acceptance means throwing away the gun and letting the tiger come if he wants to. It sounds terrible, doesn't it? Incredible that cure can lie in such a dangerous procedure, but it does. Just as facing and accepting are closely related, so are acceptance and floating. Indeed, they are so close that sometimes distinguishing between them is difficult. That was quite a lot to take in, a lot to read. Sorry, you can tell I'm getting a bit tongue-tied now and the brain's getting a bit tired. But yeah, I hope you you found it interesting and inspiring and informative. If you have any questions, just let me know and I'll get back to you as soon as I can. And I think I've already covered what have I covered. I've covered letting time pass in a previous video. I think last time I covered facing. So the next one will be floating. I do apologise because I haven't actually done them in the right order, but I guess it doesn't really matter if you just kind of go back to the videos and you'll be able to work it out. So yeah, I hope this video makes sense to you. If you felt like you enjoyed it and you felt it helped you, resonated it in some way, then please feel free to share it with others. That'd really help. Okay then, take care. Bye.